Welcome to the Nurse Edu Network. My name is Janae. In this video, I will review Domain 2, Facilitate Learner Development and Socialization for the Certified Nurse Educator exam. In this presentation, we will review Domain 2. By the end of this presentation, you will be able to identify learner attributes and needs, facilitate access to various resources to support diverse learners, assist learners to identify and develop a plan to meet professional goals, facilitate learners' self-regulation, goal setting, and socialization to the role of the nurse, engage learners in thoughtful and constructive self and peer evaluation, and promote professional development of learners. Nurse educators not only help students acquire knowledge, but they also help students to professionally socialize into the role of a nurse. This involves acquiring the skills and knowledge of being a nurse. They are accepted into the role by their colleagues. They also learn to follow the accepted attitudes and behaviors of the nursing profession. Nurse educators help students to think, act, and feel like a nurse. Nurses are continuously going through the process of socialization. Dr. Bloom identified 3 domains of learning that learning activities should be classified by. They are cognitive, psychomotor, and affective. Each domain has different levels that must be achieved from basic to complex. They should be used to guide objectives, choosing teaching and learning strategies, and planning assessments. In the next slides, I will go over each domain in detail. The cognitive domain is known as the thinking domain and involves acquiring knowledge, understanding, and the thinking process. There are 6 levels of the cognitive domain, and they range from simple to complex. The knowledge level is the most basic level of this domain because it involves memorization, defining, understanding principles that is provided during instruction. For nursing students, this could be learning about heart failure from a lecture or studying their textbooks on a specific topic. The comprehension level involves the learner demonstrating an understanding of the knowledge in a translated form. The student could summarize the causes of heart failure in their own words. The application level involves using the knowledge to specific situations. For example, figuring, writing, reading, or handling equipment. An example is the students using knowledge to write a paper on congestive heart failure. The analysis level involves breaking down the information into parts and identifying the relationships of the parts. The student is able to compare and contrast the differences between right and left heart failure. The synthesis level involves the student putting the parts together and creating a unique product. It can be oral, written, or in picture form. The student creates patient education brochure on heart failure that includes causes, symptoms, and treatments is an example of this. The final level is the evaluation level. In this level, the student is able to judge the value of something and critique it. The student completes a patient assessment to assess the patient's response to furosemide is a great example. The affective domain is also known as the feeling domain. It involves emotions, interests, beliefs, attitudes, and values. The 5 categories are organized with a degree of emotional responses to a task. This domain is difficult to measure because everyone has different attitudes, beliefs, and values. Beliefs are what a person believes is reality. Attitudes represents feelings about a person, event, or object. Values are standards that guide the student. The first level of the affective domain is the receiving level. The student is able to show awareness of a situation or event. For example, the student is able to identify fears about the first clinical rotation. The second level is responding. This involves the student responding to an experience. For example, after reviewing expectations of the class's first clinical rotation, the student feels more confident that they are prepared. In the valuing level, the student accepts the worth of an idea or event and they have desire to move forward. After learning about the influenza rates in the community, the student reflects on their own values regarding vaccination. In the organizing level, the student organizes and prioritizes values. After students share their fears about their first day of clinicals, the student is able to explain the reasons for their fears and discuss ways to alleviate them. The final level is the categorizing level. This level involves the student committing to a philosophy or value system. After learning about influenza rates in the community and ways to stop the spread, the student has decided to get the influenza vaccination and use good hand hygiene practices. The psychomotor domain is called the skills domain and involves acquiring fine and gross motor skills. It requires that students use both cognitive and affective learning. The affective domain is needed to identify the value of what is being learned. The cognitive domain involves understanding the principles, relationships, and processes involved with the skill. This domain is easy to identify and measure because they are absorbable. The first level of Simpson's system is the perception level. This level involves reading directions or watching a demonstration. For example, a student watching a nurse insert a catheter. The set level involves the student showing willingness to perform the skill. For example, the student tells the nurse they would like to try inserting a catheter. In the guided response level, the student imitates the skill with guidance by the educator. For example, the student practices catheter insertion on a mannequin with the guidance of the nurse educator. The mechanism level involves the student being able to master steps of the skill with confidence. For example, the student is able to repeatedly practice the steps of catheter insertion on the mannequin and has mastered the skill. The complex overt response is the ability of the student to automatically perform a skill with independence and without hesitation. For example, the nursing student has inserted catheters in several patients without hesitation. The adaptation level involves the ability of the student to modify the skill to meet specific situations. For example, the student feels comfortable inserting catheters on male and female patients. The student is also confident in inserting the catheter in patients of all sizes. The final level is the origination level. This involves the learner identifying new ways of manipulating objects or materials. The student is able to troubleshoot patients that are difficult to insert a catheter. Kolb's experimental learning theory is also known as the cycle of learning. It states that learning is a transformational process because it is continuously created and recreated. Students are not a blank slate. Their learning is based on preconceived ideas. Learning is not only based on the current environment, but also past experiences. Learning is from the way students perceive and the way they process what they perceive. This theory involves two different dimensions. The perception dimension has two opposite viewpoints. Some students learn best with concrete experiences where they rely on feelings more than a systematic approach. They enjoy interacting with others and benefit from experiences that involve feelings. Learners that enjoy abstract conceptualization rely on logic and ideas. They solve problems with planning and logical analysis. The process dimension also has two different viewpoints. Students that rely on reflective observation, where they rely on objectivity, judgment, personal thoughts, and feelings. They learn by viewing things from different perspectives. They also enjoy learning by watching and listening. Students that are active experimenters influence change with their actions. They learn by doing and are risk takers. Kolb describes all learning styles as a combination of these dimensions. In the next slides, I will review Kolb's 4 learning styles. The Diverger combines concrete experience and reflective observation. Students with this learning style view situations from different viewpoints. They like to observe, gather information, and then take action. They are sensitive to feelings and enjoy learning in groups. The converger combines abstract conceptualization and active experimentation. They prefer to solve problems with deductive reasoning. They prefer structure and facts. They also prefer technical skills over social issues. They learn best with demonstrations, handouts, and diagrams. They do well in specialized positions or technology. Plan learning activities that involve problem solving, experimentation, or simulation. Accommodator combines concrete experience and active experimentation. They are risk takers and prefer hands on experiences. They prefer gut feelings over logic. Accommodators can be challenging to teach because they want new experiences. They also enjoy role playing, games, simulation, or anything that involves problem solving. Assimilators combine abstract conceptualization and reflective observation. They understand large amounts of information by organizing it. They are interested in abstract ideas and concepts over people. Assimilators are good with inductive reasoning and value over practical application. They do well when they are able to reflect on what they learn and how they can apply it to past experiences. Their learning preference is lecture, one-on-one instruction, reading, and self-instruction. The nurse educator must consider the needs of diverse learners. In Domain 1, age diversity was already reviewed. Students with disabilities may experience bias. The nurse educator should refer to the Office of Disability Services to assist with accommodations. Students should still be held to the same academic standards as other students, but they should receive accommodations. Some students may have English as a second language. Nurse educators can allow students adequate time to answer, put in groups with students that their first language is English, and allow recording of lectures. A classroom of inclusion is important for students that are ethically diverse. For LGBTQ students, the nurse educators should call the student by their preferred pronouns. Students with previous education may benefit from self-directed learning. They also prefer experiences that allow them to apply learning to their past experiences. An important part of maturity in learning is the ability of a student to analyze their performance and give themselves feedback. Students should learn a skill and reflect on their progress. They can also use journaling and guided introspection. Nurse educators should provide constructive feedback. For this to be effective, the nurse educator must have a trusting relationship with students. They must also make sure students know their motive is for the student to succeed. Students can also learn by providing feedback to their peers. Reflective practice is when students reflect on their practice. In Domain 1, reviewed Kolb's experimental theory, which describes the process of students reflecting on experiences and learning from them. The nurse educator can use group discussions, clinical conferences, and journaling to assist students in reflecting about their practice. High-level guiding can be used to guide students and help them reflect on their practice and increase critical thinking. To provide constructive feedback, nurse educators should provide feedback that is specific to the behavior needing corrected. It should also be timely so the student can make changes, and it should be provided by using verbal and visual cues so students understand the correct behavior. Feedback should be diagnostic so students understand deficiencies in practice and how to remove them. Nurse educators need to know students' learning styles to ensure their learning strategies meet the needs of diverse learners. The 3 domains of learning are important to use to classify learning activities. In future presentations, we will use the domains of learning to write learning objectives. The nurse educator needs to be prepared to meet the needs of diverse learners. In this presentation, I reviewed ways to ensure that students have a learning environment to meet their needs. Constructive feedback is important so nurses can make changes to their practice. Reflective practice is a skill that students can use to reflect on their practice and make changes as needed. For this presentation, I used Chapter 4, 10, and 14 of Bastable, Chapter 1 and 10 of Billings and Halstead, and Chapter 2 of Caputi. In the next presentation, I will review practice questions for Domain 2.